So you're getting a stent put in, but here's the thing. You're awake. At best, you feel these wires and tubes wriggling around your body. And at worst, you're in considerable pain as the physician struggles to navigate. Through our extensive medical network, this was our point of view when Mike and I witnessed these procedures firsthand at Victoria Hospital in London. We were a foot away from the action as the physician was unable to guide a wire into position. So, why is this so difficult? Well, doctors are using two-dimensional X-ray imaging to see these wires inside your very 3D body. That's why we created Swerve, a thin fiber optic camera that goes inside your arteries. Swerve sees inside your vessels, providing a first-person navigational perspective, making procedures faster, easier, and safer. It is the first infrared fiber optic camera on the market and will be the only one capable of seeing through blood. Talking to our medical experts, we know they want this product. Midway through the procedure we were reviewing, the physician was having trouble navigating when he looked at us and said, "Is your first prototype ready yet?" With Swerve, he would have been able to quickly identify the opening of the target artery. And without it, this 45-minute procedure took 2.5 hours. So, you tell me, what does a subspecialist, 4 nurses, and an operating room cost an hour? Well, it's a lot more than our $1,000 disposable scope. Speaking of pricing, we'll practically be giving away the back-end system, which consists of a light source, a camera, and a display, while maintaining a high margin on the consumable scope. So all these procedures we've been talking about, they're referred to as interventional medicine, and open surgeries are being replaced exponentially by their minimally invasive counterparts because they're much safer and have better patient outcomes. For example, if you treat liver cancer interventionally instead of with open surgery, you can get the patient out of the hospital almost 7 days earlier, save $15,000, and lower the complication rate from nearly 20% down to 1.5%. So let's talk market size. Well, we've had these physicians help us segment our market, and we're targeting a portion of the $5.5 billion interventional radiology market. We've been most useful in about the top 10% most difficult procedures. But here's the kicker. Our next market is the $22 billion interventional cardiology market. And while we're going through the regulatory approval process to access these exciting markets, we're sustaining ourselves through veterinary sales first. We're Vena Medical, and we're making interventional medicine orders of magnitude easier for physicians and safe for patients. It might not be sexy or fast to market, but we're building the platform that will supercharge this transition towards minimally invasive procedures. Thank you.